The Republicans controlled this chamber from 1993 until 2006. They controlled the presidency until 2008. And now, 11 months into a national health care debate, they are just figuring out that we have a health care crisis in this country. How long will it take them to shake the grip of the insurance industry before they even come up with a realistic plan?
We have heard for months now about how we're moving too fast and how we've got to take our time, but the fact of the matter is it is time to act so that we can have an economy that can address creating new jobs.
When the Republicans took over the last time, they knocked out Mrs. Clinton's plan, and they bragged about it. And for 12 years, they made not one single proposal that they would bring to the floor for a vote. Now, they want the status quo.
The largest expansion of an entitlement program in the history of the United States of America since their creation happened under the watch of the Republican majority. It happened on a piece of legislation that we had less than 30 hours to read. There were no amendments allowed, and it increased the debt per decade by more than $750 billion. The amount of federal borrowing from foreign countries doubled under the watch of many of my colleagues here. Now, I'm pleased that they're concerned about fiscal responsibility. Speaker Pelosi has pledged that the bill will be available online, plus the manager's amendment, for 72 hours. We had less than 30 on the Medicare bill. We will not, with this legislation, increase the debt $750 billion, as did the Medicare prescription drug bill passed by the formerly majority party. Americans need health care reform. My friends on the other side of the aisle had 12 years to try to do something constructive. They failed.
139 days ago, the Republican leadership promised to introduce their own health reform bill, and yet we are still waiting. Since the mysterious Republican plan hasn't been introduced, the American people really can't see what's in it. It's all being written behind closed doors. What little we do know of what they are planning should bring a smile to the faces of insurance company CEOs. Their leader, Mr. Boehner, admitted the other day that their collection of bills does not end discrimination based on pre-existing conditions. Nowhere in their collection of bills do they help more Americans afford health care. Nowhere in their collection of bills do they end discrimination from insurance companies' practice of dropping coverage if you get sick. 4 months ago, Democrats made public our health care reform proposal by posting it online for anyone to see. Since then, there have been multiple committee hearings, during which the Republicans had ample opportunity to debate the bill and offer amendments. Republicans won't even let the public see their bill. What are they hiding?
Last night, we learned a little bit more about this mythical Republican alternative. We learned that the Republicans are going to potentially propose some collection of bullet points that deliver the status quo for people who have a pre-existing condition, for people that are under the threat of losing their coverage if they get sick. And for the millions of Americans who won't be able to afford health care insurance, this Republican plan says, sorry, you're out of luck. Listen, this Republican plan that exists somewhere out in the ether today might be good for a fantasy movie, but it's not offering anything for those of us that live in the real world. Because here in the real world, people get sick and live paycheck by paycheck and can't afford the current status quo. Let's give people real reform, not fantasy reform that leaves people right where they started.
Let's look at what our friends on the other side of the aisle are going to vote against. They're going to vote against us increasing the age to 27 where kids could stay on their parents' insurance. They're going to vote against citizens of the United States not being denied health care coverage because of a pre-existing condition. They're going to vote against us saying that no one in America will ever go bankrupt again because of a health care catastrophe in their family. That's what they're going to vote against. It's very simple. Once again, the Republican Party is going to be on the wrong side of the vote, on the wrong side of health care reform, and on the wrong side of history.
This is America's bill. We are the only industrialized nation in the world that doesn't have a plan to take care of health care for its citizens.
I'm proud that this House has finally showed the courage to tackle one of the most important issues in our country, the rising cost of health care. We have a chance to reform American health care, provide good quality, high outcome health care for all Americans.
After a half-century of debate, the time has come to make health care a reality for every single American. We must make health care a right and not a privilege. People are dying without health care. This week, we must say no more, no more.